Good morning, good afternoon, and good evening to wherever you are in the world. We do apologise for the slight delayed start. We have, on our third international webinar, we've experienced some joining problems. I am Keith Newton, the International Secretary General. This is our second topic in our series of international research items that we're covering to equip our members all over the world in best practice responses. And our theme today is safe practices in passenger transport networks. We've got three excellent speakers who you can see that will give a very broad geographical and modal approach to the subject. So let me quickly introduce those three speakers and their areas of expertise to you before I hand over to them to lead the session. So our first speaker is Dr. Dorothy Chan. Dorothy is the Women in Logistics and Transport Global Chairperson for CILT and was our International President in 2013 to 14. Dorothy is Deputy Director and Head of the Centre for Logistics and Transport at the University of Hong Kong, as well as being a Non-Executive Director of MTR. Our second speaker is Colin Kingham, and Colin is a chartered member of CILT Australia, has over 30 years experience in rolling stock engineering and maintenance in both light and heavy rail. And he's currently the manager of heavy maintenance at Yarra Trams. Now Yarra, Colin will doubtless tell us, run the largest tram network in the world in Melbourne in Australia. So welcome to Colin. And our third speaker is John Harris. John, like Dorothy, is well known to people across the world in CILT. John actually joins us in 2 weeks' time as our lead education, international education person, full-time. John is a transport planner with over 30 years experience in the field of urban planning, accessibility, rail, public transport and travel behaviour change. And John has been leading access and integration work at West Midlands Trains for the last 2 years, as well as working a little bit for us in CILT, covering rail services between London, Liverpool and the West Midlands. This webinar is being recorded, so we will make this available to all those who've registered, and it will also be on our website early next week. But that's enough from me. I think it's time we heard the experts on the subject. So let me turn to our first speaker and welcome Dr. Dorothy Chan. Dorothy.
Thank you, Keith. Thank you very much. I will try to catch up for the time. So let's start with some PowerPoints. I'm from Hong Kong, and for those who have been here, know that we are relying heavily on public transport services. Before I talk about safe practices, there is something very special for Hong Kong. 17 years ago, Hong Kong had its first painful experience with coronavirus, which was known as SARS, severe acute respiratory syndromes. In March, exactly, 2003, SARS patients were discovered, and the outbreak started from hospitals where the medical staff did not know what they were faced with, and they were infected one by one. It is very painful to witness the sacrifices of our medical staff, and very soon we realized that the whole community has to act together to prevent the outbreak. And for those who know Hong Kong, you know that we have a very dense urban environment. And the way that we can help to prevent the outbreak require extensive tracking and tracing. And that is exactly what we are doing now with COVID-19. But today we are better because we have more information and our medical staff is better protected. So overall, we have 1,056 cases as of today, with 4 deaths, but no medical staff affected. So having gone through SARS, Hong Kong community is really frightened early this year when we learn about the outbreak. And we know that we have to be prepared for the worst and at the earliest opportunity. So the outbreak actually coincided with the Chinese New Year holidays, which was at the end of January. And before the holiday ends, government have actually announced that government offices will remain closed. And eventually it was followed by restrictions on visitors from China, then Korea, Italy, whole of Europe, UK, USA, and now practically different countries are adopting different practices to control importing the virus and the spread of the virus locally. So for a relatively long period, you can see from the slides, between February and March, most government offices were closed. Schools, universities, we have to switch to online teaching, change to remote working, social distancing, wearing of face mask, and then more measures, including closure of pubs, gyms, karaoke, cinemas, gathering no more than 4 people in public places, and now relaxed to 8. So people coming from the airport back to Hong Kong, they were given COVID test immediately, and plus a mandatory quarantine of 14 days. If you now go to offices, restaurants, you have to have your temperature checked, and even filling in a health declaration form. So, but what I want to say is that the city was never locked down. Our public transport services remained open, and they are operated regularly, because 90% of us use public transport. We don't rely that much on private cars. Now, the good news is up to now, we are in May. We are actually preparing for recovery. It works. And during April and May, we have 23 days where there's no single case of community infection, but then suddenly there were 2 cases. Now we are counting again, and for 5 days, no local infection. So about 2 weeks ago, government offices were back to normal operation, and this is actually followed by the business sector. But all this means that the pressure on our public transport system has been reduced substantially. Actually, we lost, the public transport operator lost a lot of business. So this is our common streets in Hong Kong, where you feel that this is a public transport mode: buses, trams, light bus, ferries, light rail. And 90% of our daily commuter trips is made on public transport. So we cannot afford to stop public transport services unless the city is locked down. And we're also a very high urban density of over 7,000 persons per kilometer. Our private car ownership is very low. Now, but because our public transport services are provided by companies with no direct subsidies, we have to offer some relief to them, which I will mention what we are doing later on. And you can see the previous busy streets of Hong Kong shown on the left has now been turned to the right. You see that our roads are empty and long queue of taxis with no passengers. So as expected, the effect is our passenger volume was down by 40% in general, and more for some modes like taxi. So we managed the city without lockdown and keeping our public transport services working. But to reduce peak travel, we have a combination of measures like remote working led by the government, staggered working hours to reduce peak travel, and we keep our transport workers healthy. We give them a health check, and also COVID-19 test results could be available within 4 hours or even shorter, so that we can stop the affected drivers from duty, and then we can do immediate sanitization measures of our public transport facilities. But of course, you can imagine, I think, how fearful it is for Hong Kong people to go to use public transport, because you can be in touch with droplets, and of course you have to keep on being very careful, because when you touch handrails, railings, you can be in touch with the virus. So to give public confidence, we have regular cleansing, and which is on train, at stations, and deployment of robots after service closed, and installation of disinfection points where passengers can readily clean their hands. So, however, apart from this hardware cleansing, which apply to buses, trams, and public light buses, and you can actually see that passengers actually put on the face mask, and for taxis, they open the windows for better ventilation. So our public transport services in Hong Kong is heavily utilized, and we cannot maintain social distancing on 1.5 meter. And also we don't have restrictions within a train or bus or light bus where customer would sit. We have to utilize all our capacity. Although restraint measures is more strict when you go to restaurants and eat out, because when you were eating, you have to take off the face mask. So social distancing is very important. And as you get into building now in Hong Kong, your body temperature is taken, but not when you get into our public transport services. This is actually very similar to 17 years ago when we have SARS. We use our public transport services, but with adequate personal protection and sanitization. In Hong Kong, we use disposable free-ply surgical masks, which offer barrier protection for different level of aerosols, fluids, and bacteria filtration. There is discussions on the use of masks, but there is some evidence that face masks can slow down the spread of airborne viruses. In fact, most people in Asia wear the mask, not so much to avoid getting sick themselves, but to protect other people from harmful germs and virus through sneezing, coughing, and even speaking. So lately, the Hong Kong government distributed to all of us a reusable face mask, which I will show you here. This mask is reusable, and is made from 6 layers of functional materials, 2 of which are made with small quantities of copper, capable of immobilizing bacteria, common viruses, and other harmful substances. The face mask is effective for 60 washes. So after that, the face mask can be reused, but by refilling the filtration unit. Now, there is more and more evidence now that COVID-19 patients could be asymptomatic. They don't have any symptoms. So if we travel around on public transport, it is actually safer by wearing a face mask. As I said earlier, our public transport services are provided by the private sector with no direct government subsidies. But then the outbreak have created such an impact on us and our daily lives, and also the business environment, that a series of relief measures have been launched by government. Now, so I just extracted is something about 287 billion, about 30 billion pounds, 9.5% of Hong Kong's gross GDP. But sector specific, we give school bus drivers and tourist bus drivers. As you know, we lost the tourists coming into Hong Kong, one-off relief grant per driver. And for taxis and minibus is a monthly subsidy for 6 months, because they keep working, they keep serving the community. But school bus and tour bus, as the school are closed and as there's no tourists, actually there's no business. But taxis and minibuses, they keep on running. But apart from driver, the owners also get one-off subsidy per vehicle. Same for private coaches. And for franchise bus, ferries, and trams, government reimbursed 100% of repair and maintenance cost an insurance premium for 6 months. And in addition, there's fuel subsidies and wage subsidies, all right? Now, we do expect that we are going on the way to recovery since we have no new cases or massive increase in cases. And then some of the restraint measures will be relaxed soon. And this will be a challenge to our public transport operators because social distancing is very difficult on crowded trains and buses. And then we have to reinforce the public view and that it is not it is safe to actually use our public transport services. So we need the cooperation of drivers and passengers, which you get in Hong Kong. And we give them up-to-date knowledge on personal protection equipment. And actually, we ensure that the companies give workers adequate provisions. They do sanitization and cleansing, identify high-risk locations, and livelihood is supported by relief measure. Now, we have been closed our borders to visitors from mainland China, from Macau, but there are plans to reopen the express train between Hong Kong and China. So that is a challenge, how to keep long-distance travelers safe on the train and going through our boundary. And the same will speak for Macau, where we have many, many frequent visits every day. So we have to be prepared for that. And the path ahead is not easy because we know that this is going to last for some time. But CILT members are very knowledgeable about the industry, and our collective wisdom will help us whilst we are waiting for effective vaccines and treatment. So we do welcome observations and questions, which will definitely enrich our talk and help us to think about some future possibilities. For example, some of the questions that we could ask from a passenger transport point of view is that, would there be a easing of the peak travel demand in the future under the new work patterns? And assuming that the virus will stay for a while, how we can help our public transport users to remain alert on hygiene measures? Can innovation and technology help in a post-coronavirus urban environment? And more importantly, how swiftly we can respond to future crises. So Keith, we can open up to see if there are any questions on this subject.
Yes, certainly. Thanks, Dorothy. That was very interesting insight into Hong Kong. And as you rightfully said, the experience that you had with SARS has been one that you've been building on. There are no actual questions from the audience, but could I ask you just to expand a little bit more on the how sustainable you think the management of volume of passengers is in the long term in terms of peak flows, reducing peak flows, and how important do you think that is in terms of enabling people to feel confident of travelling on public transport?
Well, actually, the peak travel pattern in Hong Kong is really very peak, and we have to spread it out. And in fact, employers have been very cooperative during this period. First of all, they allow remote working. And for the past few months, we have a core team coming in, and there will be 2 days in a week where you are allowed to work from home. Now, it turns out that the efficiency have not slowed down because of working from home. So employers may gradually discover that maybe this is a pattern that they should do, because the consequences is, if one of the colleagues is a COVID-19 confirmed patient, the whole office has to be closed down. Now, in the past, we closed down for 14 days. Now we have the confidence that maybe with thorough sanitization, the office can be reopened, but those staff in close contact with the COVID-19 patient have to impose self-quarantine. That means they will have to work from home. So this situation, the government also will change the level of restraint measures in response to outbreaks. More outbreaks occur would affect our medical capability to handle. Now we have to have quarantine centers. We have to have enough tests per day. You know, our aim is to be able to do over 7,000 COVID-19 tests per day if visitors are allowed to get into Hong Kong, and they have to be placed in quarantine center. So at the moment, out of the 1,025, 56 confirmed cases, 1,025 has recovered. So in our hospitals, we are now handling 25 COVID patients. So we have to reintroduce the measures gradually. So on the 27th of May, we have the school back for secondary school. And in June, we have the primary school back. So our medical system have to remain alert. So I do think that the peak traveling would continue to be dampened through various staggering and work from home measures.
Right, and Edward Lau actually asked a secondary question, Edward from Singapore. Will the public transport providers be increasing the service frequency to ensure sufficient capacity is offered? Are they doing that in Hong Kong in terms of more frequent trains, or are they more seeking to manage people and the peaks by encouraging different ways of working?
Well, actually, in Hong Kong, between March, April, we have cut down a lot of frequency because the passenger volume was down by 40%. At the moment, there's some recovery, but we're not back to 100%. But if we do, we have to put in extra capacity. That is not an issue. And also, fortunately or unfortunately, the rail company, during this period, we opened up a new line. We opened a new line in March, and that means that we were able to spread out the passengers on some of the existing lines. So there are plans to open up more new lines next year. So the rail system will continue to expand. Now, as for buses, I think it's relatively easy for them to add on the capacity in response to demand. Yeah.
Excellent. Well, thanks, Dorothy. We've got a couple more questions, which I know are going to be covered by both Colin and John, but we'll also open up at the end. So I'll wait on those questions until the Q&A at the end. But going to hand over now to Colin to give us a perspective even further east, or whichever way you go, might be west, from Melbourne in Australia. So over to you, Colin.
Well, hello all, welcome to the presentation. My presentation, unfortunately, is a little bit tram-centric because that's my key area of interest. But I think the other speakers will certainly cover the other modes a little bit more in more depth than I am tonight. But just a bit of an overview of Melbourne. Melbourne is the second major city here in Australia. Its population just shy of 5 million. We're quite fortunate, I think, in Australia, and I think our governments have been very proactive in terms of the way they've handled the COVID-19 crisis or the coronavirus crisis. We only have, at the moment in Australia, 7,079 cases. We've had 100 deaths in the country. We had 11 new cases in the last 24 hours. And of those 7,079, we've had 6,442 recover. More locally, which is about where the Melbourne tram network is, we've only had 1,573 cases in Victoria, of which there's only been 18 deaths. So quite low relative to the other parts of the other more major cities around the world. In terms of where Melbourne itself has gone into a bit of an isolation phase, and all of our hotels and restaurants and everything are closed. The only type of food that you can get here, and you can't get any dine-in type food, it's all takeaway food. And to pick up on one of Dorothy's points about travel, unfortunately in Australia, public transport isn't quite the mode of choice. The mode of choice by far is the motor vehicle, and it's probably a bit to do with Blaney and the tyranny of distance. We have long distances between a lot of our towns. So yes, that's just a bit of a general overview. I'll now move on to my presentation. So the Melbourne tram network, it's reportedly one of the largest operational tram systems in the world. And our claim to fame is that it's the largest in terms of track length. So we have 500 kilometres or 250 kilometres of double track. Unlike Dorothy, we only complete 200 million trips annually. So that's about 540,000 a day. Nowhere near the 12 million that Dorothy's sees in Hong Kong. We operate about 5,000 services daily, just over. We've been operating as an electrified tram network for over 100 years. And 75% of our network, unlike a lot of other tram systems throughout the world, is shared with other vehicles, mainly road vehicles and taxis. And so we share the same roadway and the same pathway, and they can actually drive on the same piece of pavement that the trams actually drive on. It's quite confusing, and unfortunately, we have a lot of accidents. We have on average, about 3 motor car to tram accidents every day. We're a 24-hour operation, 3 days a week, and the rest of the other 4 days, we're operating 20 hours a day. So pretty intense operation. We've got 490 current trams. That's growing. It keeps growing because we're getting new trams delivered every month. These are similar for the UK people. They're very similar looking to the Blackpool UK-based tram. It's made by the same company, Bombardier. Ours is a little bit different. It has articulated bogies. We've got over 2,200 employees, and 1,200 of those are drivers. And we have about 1,700 tram stops. We have a lot more tram stops than most tram networks in the world. We've got very short distances between a lot of our stops. We're moving towards accessible tram stops, and the aim is to get all of our tram stops accessible, fully accessible by 2032. Currently we've got 420 are fully accessible to wheelchairs and other disabled people. And we have 9 depots across Melbourne, which is large compared to most tram networks. On the 11th of March, as we all know, the World Health Organization declared COVID-19 outbreak a pandemic and then advised organisations to implement strategic objectives to reduce the spread of the virus. That's about the time when it really started to hit home to Australia. Up until, I know Dorothy and other parts of the world had much earlier outbreaks, we really didn't have much at all until about then. That's when the World Health Organization declared it, we really started to have to think seriously about it. On the 16th of March, Yarra Trams decided to make a decision to allow all of our office workers to work from home, to spread and limit the exposure to COVID-19 or coronavirus. The initiative has been widely adopted by the broader community as well, and has led to a significant drop in patronage. Our patronage is down by about 80% on both rail and tram networks here in Melbourne. So no problem with social distancing there for the patrons, because there's very few people on the vehicles. At Yarra Trams, we've been conducting regular online briefing sessions and QA sessions, keep all of our staff informed, and this commenced on the 18th of March and was twice daily, but given that now it seems to be under a lot more, we've flattened the curve here in Australia, and particularly in Melbourne, we've dropped that, the frequency of that down to 3 times a week, once per day. We have all of our operational directors participating and leading this, so it's, you know, there's a strong commitment from the top to manage this crisis that we're going through. We also formed a business continuity group, and that group has been working continuously through to develop initiatives to help minimise the risk of Yarra Trams staff and our customers of contracting infection. So part of the work that the business continuity group have done is developed a pandemic plan. The pandemic plan is a very thorough document. It takes us develops a strategy, preparedness and prevention, and response and recovery and regulatory issues. We've also developed a business continuity plan. So the business continuity plan is all about ensuring that we've developed enough scenarios to work out how we could continue to operate the network should we lose one of those depots or more than one of those depots. We've worked out exactly where we can operate the trams from, move the trams around, move the staff to, and things to help us continue to provide a good public service to Melbourne. The business group is also analysing daily all the emerging issues and any impacts on the business and developing strategies to mitigate those. As I said, the office-based staff are working from home, and we've developed a checklist for office-based staff so that they can make sure that they're working safely and that their office at home is ergonomically correct. We've also done, a bit like what Dorothy said, we've gone down the path of deep cleaning all of our trams every night. So every tram gets a full clean every night by a contracting company. They come through and go through the whole lot. That's quite a comprehensive clean every single hand point and all of the touch areas. We also try and clean most of the tram stops and termini. It's a little bit more difficult than the trams because it's hard to get out to 1,700 tram stops every night. So it's sort of like a bit more cyclical in terms of which tram stops get cleaned, but there is a thorough cleaning program for all of those. In terms of the trams, when they come into the depots to have maintenance performed on them, there's localised cleaning of those trams, and that's done by the maintainers themselves. They have to don the appropriate PPE, which is gloves, disposable overalls, and then they use sanitizer and disinfectant, and also ensure that they've thoroughly washed their hands pre and post any of this cleaning. That's prior to commencing any maintenance works, particularly on the areas that they're likely to work on and touch. Handling lost property has been an interesting one for us because unfortunately, we get a lot of lost property. I'm sure Dorothy probably does in Hong Kong as well, where people leave things behind. So now the instruction's gone out to all of our drivers not to accept any lost property. And if someone picks up some lost property and tries to present it to the driver, they're told to take it to the nearest police station. Similarly, at night when the tram comes in, if there's lost property left on the tram, the cleaners then bag it and take it in and put it in the operational office. And then 3 times a week, that lost property is removed and taken down to the local police station as well. Tram cabin hygiene. So the tram cabin hygiene is really on the drivers themselves to ensure that when they take a tram out on a run, they do some preparatory cleaning, they get alcohol wipes, and they wipe down all the touch surfaces and all the control knobs and that they have to expose themselves to on the vehicle. And the other preventive measure we've put in place here is shared vehicle hygiene. We have a lot of road vehicles that we use here and plant and equipment, forklift trucks and other plant and equipment that we use. So the local employees have to maintain and ensure that's clean. Even on some of our forklifts here, we put we actually did make a suggestion about putting sanitizer and cleaning agents on vehicles, but we just couldn't do it. We had too many vehicles and not enough, and we were struggling to get hold of the materials to be able to do that. But we did do it on all of our own local plant, so that the drivers have all those alcohol wipes and sanitizer at their disposal when they go, before they go to operate any type of mobile plant or equipment or vehicle or road vehicle. Managing vulnerable employees was an interesting one. There was a rule that we wanted to, any employee that was over 70 or aged over 65 and had chronic medical conditions as listed by the Australian government, or any employee that identified as being Aboriginal or Torres Strait Islander. So I strongly encouraged to stay at home, and if they couldn't work from home, take leave. PPE, we've been very strong on PPE here in the workplace and also for the drivers. So gloves are quite frequently used and most people are using the gloves. Masks only when needed. So we're not using masks very much here in Australia and not very much in the workplace. The only time we use it is we're actually doing work where there's massive risk of, or it's normal to use masks for things like dust from sand and things like that. We use sand to assist braking. But sanitizer has been regularly provided in all the workplaces, so sanitisers there, as well as good documentation all over the workshops and workplaces about how to wash hands and training people on how to use products, all the products like sanitizer, like disinfectant, and also strong, as I said, on hand washing. Social distancing measures. So we've tried to enact social distancing measures across the workplaces. We've taken down any recreational type equipment, things like pool tables and table tennis tables, got rid of all that sort of shared equipment. Unfortunately, it's a bit boring for the drivers at lunchtime, but we've done that. We've also staggered the shifts. A lot of the shifts in the workplaces were the maintenance shifts, and made sure that all of the meal areas, the cafeterias and things like that, the table seating allows for the 1.5 metre distancing between each place, and each table basically is the 4 metre rule as well applied to that. So quite strong on that stuff. The other one is tram internal social distance barrier bars. We've tried to, the drivers were concerned that when they get out of the tram cabin, they have to go through the tram to go and sometimes change the points if the points haven't operated automatically or for whatever other reason. So we roped off some of the seats near the driver's cabin so that they can get clear access to the door without impede or having to meet or come across any passenger directly. We've also gone on a campaign, not sure whether it's valid, but we've decided to do it because it was a good positive initiative, and that was the replacement of all the tram air conditioner filters almost every 2 weeks, rather than the normal 3 monthly service. So I think there was a concern that the filters would could potentially contain COVID virus, so we've gone down that path as well. We also did, I think, a very positive step here, and that was the flu vaccination program. We're heading into winter, and what we wanted to do was try and eliminate where people had symptomatic type conditions which weren't COVID-19 related. So just the normal flu. We wanted to try and make sure that, and we strongly encouraged everyone, even people that don't normally take place in having a flu vaccination. There was a big drive to do that, and we even engaged the local chemists to provide free flu vaccinations to our staff as well. Drug and alcohol testing is another thing. We have a regular campaign where we do random drug and alcohol testing on all our drivers and all of our staff. In fact, it's 0-0 for alcohol and drug here. And the way that's normally done is the staff are randomly selected. They've got to put their hand into a bag and basically pull out a marble. It's either a red marble or a black marble, and if it's a black marble, you go off and have the proper test. So what we've done with that is we've now made it so that the tester is the person that pulls the marble out, and they just have to accept they either got a red marble or a black marble pulled out. This is just an example photo. I didn't do as many photos as Dorothy. Sorry about that, Dorothy, but this is just an example of the type of suiting and equipment that our tram cleaning team are doing on every tram every night. That's the interior of one of our trams being comprehensively cleaned by one of the contracted cleaners. We also spent a lot of time developing what guidelines for managers and supervisors in what to do when they actually received a positive test result, if one of the staff members had received a positive test result. Fortunately, in Melbourne, in our tram network, we've only had 2 positive identifications, and both of those were not at work when they hadn't been at work. One came back from overseas, and the other one was community transmission, but was on holidays at the time. So we were quite lucky there. But the procedures are well developed and basically take the managers right through every step that they need to do once it's been identified, and finally, basically the person cannot return back to work until they've been given a formal written medical clearance from the medical practitioner. I think at that point, our teams here in Yarra Trams should be congratulated on the handling of the few instances of people that are feeling unwell. And I think stems back to the upholding of social distancing and really great hygiene, which has kept the risk very low for us. If a tram was suspected to be have been exposed to COVID-19 contamination, we have some really strong processes in place for that. This has all been really well documented. So the tram's taped off and reported to the control centre, then arranged for the contract cleaners to come out to it straight away, and the tram's quarantined for 24 hours just to make sure that we've given it the thorough clean. A pandemic recovery plan. So we've spent a lot of time developing a recovery plan. Now the recovery plan is basically taking us through how we will get back, how we will bring Yarra Trams back to operate in a normal situation. It's covering everything from workforce returning back into the office environment, and how to deal with passenger loadings as they come on board. So in summary, the next phase, Melbourne's slowly coming out of its lockdown with limited easing of lockdown restrictions, which commenced on Tuesday, the 12th of May, mainly due to the low levels, as I said, of community transmission and minimal cases being detected following widespread testing. They've gone on a really widespread testing campaign, car parks, shopping centres, things like that, where people can just drive through and get tested, and really low. The changes haven't really directly affected Yarra Trams, and our COVID-19 practices will continue until further notice. However, because of the reduction in the lockdown, it is expected there will be an increase in passengers and patronage as a result. We're currently considering the possibility of allowing office-based staff to return to work on a week-on, week-off basis, just to enable social distancing to happen. So we're allowing, where the current proposal is to allow, it hasn't started yet, but we're thinking in the next couple of weeks, we'll try and allow 50% of our staff to work in the office and the other 50% to work from home. And then we'll alternate that each week. So the 50% of staff that worked the previous week will then work from home and vice versa. In the coming weeks, we'll ascertain what may need to be done in terms of loading restrictions. However, at this stage, it's highly probable that public transport in Melbourne will be exempt from social distancing rules. There has been talk around potentially the use of masks and making it compulsory to wear masks, but that hasn't been, unlike Hong Kong, that hasn't been put into law or anything yet. As the coronavirus restrictions are in the coming weeks, it is expected we'll see an increase in road traffic here in Melbourne, particularly cars, as more people return to work and schools. That's because I think that, you know, there's a possibility that people won't trust public transport to be the safe mode that they know it's been up to date. The other noticeable change has been a significant increase in the number of cyclists taking the roads in Melbourne. Melbourne City Council actually considering the rollout of 12 kilometres of new temporary bike lanes to encourage people to use bikes rather than public transport. Some of our politicians have actually actively been encouraging people or urging people to avoid using public transport for the aforementioned reasons of potential contamination. One of the consequential impacts has been a significant drop in fare box revenue of over 80%. Which has been putting added strain on us operators who are still operating at full service. We haven't, unlike Dorothy in Hong Kong, we have not cut one service. We're in fact running slightly above what we normally run. And the aim is to assist with the social distancing, just to guarantee that we can maintain good social distancing. It will be interesting to see the long-term impact on public transport networks in Melbourne as a consequence of commuters currently using alternative forms of transport while the coronavirus is at large. We're hopeful that that's not the case, but that it's not a long-reaching and far-reaching impact. But fingers crossed. I'll hand over to questions if anyone's got any questions they'd like to.
Yeah, Colin, I think what we'll do is we'll move on to John's presentation, and then we'll take the questions all together at the end, because I think the picture we're hearing now, this is, so the detailed operational responses in Melbourne, fascinating to sort of see what you're doing, contrast that with Hong Kong, and there's lots of parallels, but there's also differences.
Yes.
And we're now going to take a view of the UK, which is further back along the track in terms of where we are with the peak, and we're coming out of the peak, we would hope, in the UK, but it's still been a pretty massive peak. So John, so thank you very much, Colin, but we'll come back on the questions, as I say, at the end. We'll move to John, who's going to give us that perspective from a West Midlands Trains UK operating viewpoint. Thanks, John.
Okay, well, thank you very much for having me on this webinar, Keith. I'm going to perhaps look at this from a slightly different angle. We certainly share many of the challenges that Dorothy and Colin have already talked about. What I'm going to do is turn this a little bit on its head around, well, what happens after this curve starts to recover? And what do we need to do now in order to ensure that the number of people that are actually catching rail and using rail now will actually return? That's one of our key challenges we're facing at the moment. So the current rail industry challenge here in the UK is very similar. We've seen 90 to 95% drop in commuting and rail use behaviour across the network. Those of you that may have watched Sky News or BBC will have seen that in London there have been some specific challenges around people commuting into mainline terminals, but also using the underground network. Transport for London probably have the biggest challenge, because even with running all their trains, trying to get social distancing in place would mean that only a very small proportion of people that normally catch the underground would actually be able to use it. That's why they are emphasising using bike hire, walking and cycling for the last mile from our mainline terminals in London, of which there's about 12 or 13 of them, to get to your end destination. So there is a bit of a challenge based around London, and of course part of our network actually feeds into London Euston, which is one of the big main terminus stations. So there is a bit of a challenge there in terms of safe access. We are really keen that if people come in on what we call heavy rail, that they do switch to walking and cycling. They will probably get there just as quickly than going down escalators and waiting on busy platforms. The picture that you can see on the right there of your screen, that's Birmingham New Street. So it's the biggest station on our rail network. And what's interesting is that's the view a couple of days into lockdown. And even when I went back into the office a couple of days last week for some essential work, it was very, very similar. We were also expecting a lot of people to come back to rail this week because of the government announcement to, instead of stay at home, it was to stay alert and start to move around if your travel was essential. However, our marketing campaign on both our networks, that's the London to Liverpool route and the West Midlands suburban network, was stay at home. And as a result of that, we went out on Monday, extra staff deployed to secure stations as to make sure there was not overcrowding. I only saw 30 people in around about 2 hours. So people are really taking this seriously. Clearly there is an economic impact, and here in the UK, the government has basically taken back the keys for running the railway for 6 months. So we are on what's called emergency measures, which means that the government is meeting the costs during the coronavirus crisis. And then it looks to return to the franchising model in October. Another thing that's important is that we have seen this massive uplift in cycling, and around 36% generally across the country, 36% increase in cycle trips. Now, this has caused us a challenge because we can't really afford for people to take bicycles on the train. And what this does is, it, because of where people put their bicycles, what that means is it then gets people to sort of herd together, and they can't adhere our 2-metre social distancing rules. So I think we are at the moment watching this carefully, because we don't want to be seen to be discouraging people from cycling to the station. But what we don't want people to do is bring full frame bicycles on the train, then causing problems and bunching of commuters later on. So that is something that the rail industry has to respond to as a whole. And the reason why it's so complex in the UK is that because we have private operators, of which West Midlands Trains is only one, in order to get decisions made about how to respond to the coronavirus has involved decisions across multiple rail operators, in fact in excess of 20. They serve very different environments. So you have Scotland, which you would think that in the Highlands of Scotland there's probably not much of an issue, but if you get to Glasgow or any big city, you've got the standard commuting issues. You've then got very dense rail networks around London and the South East and the West Midlands. So it's a complex problem because not every policy affects each operator in the same way. And we have to be very careful about sending out 20 different messages. We want people to be safe. So that means that the Rail Delivery Group, which is a consortium of all of the train operating companies, has to get together and make a consensus decision very, very quickly. Now, I mentioned active travel and walking and cycling. There's another important aspect which I just want to focus on. And in the UK, we have legislation called the Equality Act that was passed as law in 2010. The challenge is we still have disabled people, those people with mental health considerations, needing to travel on our networks. Now, they may be key workers. They may also be needing to access critical medical care and hospitals and health centres. They have to keep moving, but we have to be really responsible in how we deal with their individual journeys. So the area of focus that I've been looking on is how we help those people that really do rely on the railway as a lifeline get from A to B. And you'll see the bottom pictures there. This is examples of our social distancing campaign, the information that goes at the ticket offices, screens being put up, hand washing facilities. So our accessible travel policy, ironically, is designed to help all disabled passengers, elderly people, etc., move around our network. And it was due to be published this month. And then, of course, along came coronavirus. What we have to be very careful about is that customer needs are not always visible. And there will be people that suffered heightened anxiety. They get worried about their journey because it's not normal. They're scared of the environment. And we have to do our best to reassure them by asking them to follow pre-booking processes so that we know that they are coming and we can cater for them. So what we've been doing is setting up videos and specialist advice and support for vulnerable travellers. And this is an example at one of our stations in Birmingham. You can see all of the markings on the floor to aid social distancing. And we've also produced additional material for web to really try and support vulnerable users to plan ahead before they make their journey. Now that's our operational side of things, but there's a lot of work going on in the background around how we harness longer term changes in travel behaviour across our network. We've been developing over the last 18 months the Stations as Places programme, which very simply is an accessibility prospectus that is used for every station on our network. And we're working around our 140 stations, looking at how we can improve access to that station, encourage more walking and cycling, and get people to move towards rail. Now, our big challenge is because people are now staying away from rail, the figures around is that we could see up to a 23% drop in people using rail. And that's because people will no longer commute into cities every day. they will start to commute 2 days a week and then work at home. We'll start to see trends where, for various reasons, people will go back to the car. So in terms of how every individual station and community we stop at responds, we are now using this strategy for post-COVID recovery, not just as a kind of a good technical land use planning document, but something that will give confidence back to the railway. In order to do that, we're working with local councils, municipalities, and community rail organisations, because at a local level, they're the ones that we will rebuild confidence in train travel. There is a big push, both internally across our workforce, but externally around health and well-being. And we want to use our station travel planning approach to try and support the culture shift that has happened overnight. Many of the experiences in running the Olympic and Paralympic Games around remoding people, reducing pressure, retiming the way people use the trains are going to be critical in making those site-specific strategies effective. That's my snapshot through the world of West Midlands trains. But what we'd hope to see is in 6 months' time, we can actually harness some of positive stuff from this, including seeing more people walking and cycling to stations and using the train services more effectively. Thank you.
Excellent. Thank you very much, John. So that was, again, another insightful view of what's happening in a different location of the world. And very much in the spirit of what we're seeking to do is share experiences so we can learn across the countries as we now sort of move into phases where people are coming back on trains. But what I'd like to do now, thank you very much to all three presenters. I'm sure you agree have done a wonderful job there. We've got a few questions. We will take questions. We will aim to finish in just under 15 minutes time. So we'll take a few questions. I'll be quite direct with the questions and ask the three individual panelists to answer them mainly. Some good questions, which I think you can see the visibility on. Colin, a question right at the bottom from Rob Mayo about mask wearing. I think you described that as being optional in Australia, didn't you? The question here is, what is Yarra Trams' position on passengers wearing masks on trams, and what's the state government's plan to encourage mask wearing? Will mask wearing become official policy in your view?
I don't believe so at this point in time. All of the local media and everyone else here and politicians are pushing that mask wearing isn't actually beneficial. Now, I know that it's conflicting with other parts of the world, but that's a current position here in Melbourne. Yarra Trams themselves actually bought a lot of masks because we thought that was probably going to be a method of getting people back onto public transport, and we could give them out, issue them out freely, a bit like what they've done in these are more disposable single-use masks. But yes, it's an interesting conundrum, and but there's no, from a Yarra Trams perspective, there's no discouraging people from wearing masks. If they want to wear masks, free to wear them. And but in terms of a forced policy at this stage, no, it doesn't even look like.
That's interesting, and I'm sure that debate, what we're not is politicians here, very definitely. So, but that's interesting to see how that's being approached in Australia. Dorothy, you showed some pictures of robots disinfecting the inside of the carriages, which I thought was very interesting. Warith Al-Karouzi has asked, how effective are the disinfectors equipment used on public transport? And you, of course, you've got the experience over several years of that. What's your view on the effectiveness of the disinfection?
I think the disinfection is very effective. In fact, these sanitizing measures, we have been stepping it out since 2003 when we have SARS. Since we have that, so the public transport operators have been sourcing, around the world how sanitization can be made more effectively. And in fact, the hydrogen peroxide robot have been used. And in fact, some of the airplanes, I think, are also using this. And it can actually kill the virus and make sure that the place, hopefully, when it starts service, is clean. But you will also actually find, if you use the train service in Hong Kong, you will find cleaners getting on board of the train and clean the handrails. The important thing is that we were advised not to touch our eyes, our nose, because that is the way where virus can get into our body. So the way that is that frequent cleansing of the hand is very important. And because also there are some studies which shows that if the sick person sneeze, cough, then the droplets can go as far as 1.5 meter before it drops. And that's how the 1.5 meter for social distancing comes about. And sometimes if you put on your mask, it will help to prevent you from touching your face. And so it becomes quite habitual. And for home, of course, for offices, buildings, Hong Kong has a lot. It's used multi-story building, so we have lifts and we have lift buttons. So this was regularly cleaned on an hourly basis, so to reduce the risk. And more lately, in one of the cases where books, Bibles, when the gathering of worshippers get affected, then government go and actually do an environment screen and found that there were virus deposited on the cover of the books. So we are having book cleansing machines as well in the schools.
John, similar point, because we're at this stage of trying to sort of reduce the risk of transferring the disease. Abu Bakar Kamara from Sierra Leone asked, what do you think about positioning tanks of water for hand washing, soap, sanitizer before entering public transport? Are you doing anything with West Midlands trains on hand sanitizing and hand washing, etc.?
Yeah, so in terms of the staff policies, again, this is around the whole rail industry doing the same thing. So there's been some quite detailed guidance put out about social distancing and what that means for staff protection, okay? And also around the PPE situation as well. We, at the moment, when we went on to do reserve support, we were told we can wear a mask, but it doesn't have to be a PPE mask, if that makes sense, in terms of full visors and equipment. What we're trying to do is mitigate by repeated hand washing, make sure that the sanitation at the station, all the common areas, the ticket office, the ticket machines, go through a very rigid cleaning regime. And obviously at the moment, our message is actually avoid travel. Now, as things start to come up and there starts to be a ramping of that, we're going to have to monitor very carefully loadings on trains, frequency of people touching things like ticket machines, because our ticket machines are touch, you have to touch the glass. So I can see there being a ramping up of some of the cleaning regimes going forward. What we have done, interestingly, I put it on the chat, but we, all of our managers that don't normally go out and do station duties were asked to volunteer now. There's around about 350 of us. So what that allowed us to do was to go to all the local stations near to where we live and offer a helping hand on Monday. And the idea was if people started to return in mass, then we would be able to enforce, if you like, the distancing and make sure that people felt safe. We weren't needed. By 9 o'clock. We decided that this bulk return wasn't happening. We're not seeing the same trends that we've seen in some of the London routes.
Right, excellent. No, thank you. That's given us there's some very interesting questions. Richard Butler's asking one that I think would be worth a webinar in its own right about how sustainable is the future funding model, assuming much higher sanitation cleaning costs and basically lower passenger carrying capabilities. John, you mentioned the fact that actually at the moment the whole funding model has been suspended for 6 months in the UK. What's the view in Hong Kong, Dorothy, about that from a sustainable and the economics of the transport businesses?
Yeah, I think Hong Kong is probably one of the few cities in the world that public transport services are operated by the private sector with no direct government subsidy. So we do have a sort of unfair adjustment mechanisms which enable operators to recover cost and have a profit. But with this COVID outbreak, already the community is suffering. What you are hearing today is lockdown, slow down, shut down. You have not seen the word up. Or definitely not with the COVID-19, don't go up. But then, but emergencies also actually give us the impetus to do the fast forward. All the operators have to adapt to a new operating environment. And during this period in Hong Kong, government plays a more prominent role. Inevitable, they have to play a more prominent role. But then for policy maker, how to pay this bill in a way that will keep public in good shape is very important. So we may be spending in advance money from our reserve. This is an investment in advance to bring the community back to a sort of a healthy path to recovery.
Yeah.
And we have been looking at this situation, and I think that maybe in about 6 months' time, we will be addressing the recovering pathway, in a more aggressive manner.
Yeah, yeah. No, and yeah, so plenty, I think, for us to focus on as we go forward, which we will be doing on our future webinars. So thank you very much to Dorothy, to Colin, and to John. I can see it's already, the street lights are on in Melbourne, so he's heading into his evening. But we would like our international president just to make a few closing remarks. So I'll hand over to Dr. Radzak just to finish the session off.
Thank you very much, Keith. Sincere greeting from me to all of you attending this webinar. And also thank you to our three excellent speakers for covering this critical global subject of safety in passenger transport, for the excellent questions and answers. We have covered 3 different parts of the world and 3 different approaches, but provided, I think, much to learn from and adapt wherever we are. I'm quite impressed with some of the things that you all have put up just now, but my mind is still thinking about the new normal is right in front of our eyes now. When you are talking about tram, you are talking about rail, you are talking about public transport, there are companies, there are organizations that have been well organized, and you can see that the issues of sanitizing, disinfections, and all those coming to being. But what about the Uber? What about the Grab car in Malaysia and Singapore? Who's going to sanitize their cars? Co-Uberization is being concept to be, is being a new normal concept to us, and everybody, especially the youngsters, is going for it. But what are we doing with that? That is why I hope that in the near future, if we can, CILT International can come up with a very strong SOP for all those operators and all that. If anything happen with all these operators of Uber, Do you think that the company is going to be responsible? I could see that even in Malaysia, almost every day. You know, the riders that carry Food Panda and Grab Food and all that, they're being killed because of accidents. I mean, it's just, you know, like that, you know, and you know, you just bury it with some kind of ceremony and all that. But what else? But that is going to be the future of the public transport. So I hope that in times to come, we should be able to talk about what you call this concept of public transport, yeah, Uberization. Well, at the same time, we have, of course, not covered air passenger transport, and we hope to do that in the near future webinar. Last week, we issued our 4th bulletin, focused on safe practices in passenger transport networks. So please also look at that material which covered all sectors of the industry. This webinar has been recorded, so please share the recording with your members and colleagues in your country and region. Join our online discussions and participate on our international and branch social media platform. For those in the branches and in the territorial organization who are doing their own webinars and resolution of that webinar, please send it to the international, so that the secretary can compile and I can disseminate as bulletin. Our next topic in our series of global shipping, in our series of webinar is global shipping and the supply chain. Please share with us your local research and expertise in this area. We will issue our bulletin on that subject on May 28 and hold the webinar on 3rd June. So please add that date to your diaries. Last but not least, keep safe, everybody, and thanks again for joining us today. Goodbye.
Thank you, everybody.
Thank you.
And thank you for those who've joined us from all around the world. Have a wonderful rest of the day. Thank you.
Thank you. Thank you.
Bye.
Thank you.
Thank you.